Welcome to Suturing 101. This is a step-by-step tutorial on how to perform some of the most commonly seen suturing techniques. We will also give you a quick rundown on commonly used tools and terminology. After doing this e-module, we promise that you'll be able to suture with your toes in the dark while juggling. Okay, that's a lie, but we promise that you won't look like an idiot in the OR when you're a third year and the surgical tech slaps a loaded needle driver into your hands. So first things first, here is a labeled image of some of the tools you'll need to get started. This is by no means an exhaustive list of all surgical equipment, but it should be enough to get you started. Starting on the left, you'll see what we call the needle holder or needle driver. Different people use different terms depending on where they trained, so just call it what your attending calls it. The needle driver has the ability to clamp down and stay locked in that position, so it is used to hold the needle while suturing. Next, we see the Adson forceps, which are commonly referred to as pickups because they are used to pick up and manipulate the skin edges so that your needle enters the tissue at appropriate angles. The scissors are used to cut the suturing material. And last, you have the scalpel. If you don't know what a scalpel is, then you need help beyond what this e-module can offer you. If you look at the top of the image, you see the package that contains the actual suture. This comes attached to the needle. There are many different types of suture material and needle sizes that are beyond the scope of this tutorial. However, I will mention that for needle sizes, the smaller the number, the larger the needle. For instance, if someone asks for a 2/0 of Vicryl, the 2/0 is the size, and a 2/0 needle is larger than a 3/0 needle, which is larger than a 4/0 needle, and so on. The Vicryl simply indicates the type of material the suture is made out of. Feel free to refer back to these images for reference. Alright, so now we know the tools, what do we do with them? Before we talk about the different types of sutures, we need to mention some rules. First off, never grab the needle with your fingers. This is an accident waiting to happen. Instead, use the pickups to grab the needle when loading the needle driver. Be careful to avoid grabbing the tip of the needle, as this will blunt it. With the needle driver, grab the needle a third of the distance between where the suture enters the needle and the tip of the needle. The axis of the needle should be about perpendicular to the axis of the needle driver. Using the Adson forceps, or the pickups, for skin retraction, insert the needle tip into the tissue approximately 0.5 to 1 centimeters from the wound edge, making sure to begin with the needle perpendicular to the tissue surface. Supinate the wrist clockwise 90 degrees to facilitate needle passage through tissue. The needle should traverse the epidermis, dermis, and a small portion of the subcutaneous tissue. So you've finished suturing. Now you have to tie a knot to secure your stitch. Knot tying is a whole different beast that will be covered in a separate e-module, but we will show you how to do an instrument tie here. This is exactly what it sounds like. Rather than tying the knots with your hands, you're simply using an instrument to help.